Hello everyone, and welcome to the sixth session of the webinar of the Research Facility on Inequalities. I'm Amanda David. I am the lead economist on inequality and the scientific coordinator of this program. The facility, funded by the EU and implemented by IFD, comprises of more than 20 research projects, and we have launched this webinar series in order to present some of the results. In our previous sessions, we've talked about issues such as taxation, perceptions of inequality and social mobility, public service access, and also the multidimensional aspects of inequalities. Before we start, a few guidelines on the webinar. As you will see on the right of the screen, there's a questions feature as well as a chat feature. You can type your questions in the question feature and the presenter will answer them after her presentation. You can vote for the questions you think are more relevant. And just after the presentation, I will select some of them and address them to our speaker. If you have any remarks or if you'd like to just interact with the other participants, feel free to use the chat feature. The webinar is recorded and the replay will be available quite soon. In today's webinar, we will be chatting to Nkechi Owo, a researcher at the Department of Economics of the University of Ghana and also part of ACER. Welcome, Nkechi, and she will be chatting to us about consumption inequality in Ghana. Thank you to all of you for being with us today, and I will leave the floor to Nkechi. If she can you, yes, okay, that's perfect. Hello, so you have 30 minutes.
Okay, thank you very much for the introduction, Anda. I'm very pleased to be here. Today I'm going to be talking about our paper titled Exploring the Dynamics of Micro-Level Inequality, the Case of Ghana. This is the outline that the presentation is going to take. Now, economic inequality is a very important area of concern for citizens and governments around the world. Now, it's important for a country to be aware of its inequality status for a number of different reasons. First of all, it helps the country to assess the effects of different government policies that are being implemented. Additionally, it's useful for the design of appropriate inequality-reducing interventions and programs. Now, although we are aware of the critical link between economic growth, poverty, and inequality, economic growth on its own is not a sufficient condition for improved welfare. Indeed, it has been argued that economic growth could lead to a widening of the gap between the poor and the non-poor. Now, Ghana has recorded impressive increases in its growth rate over time. In the early 1980s, the growth rate was as low as -7%, and by 2017, it had risen to about 8.5%. According to IT and FINI, the country recorded its highest economic growth of about 14% in 2011, largely as a result of its receipts from the mining sector. Despite the impressive growth rates, the benefits of this high growth have not been evenly distributed among different groups within the country. Indeed, some researchers have noted that inequality has been rising over time. Now, we care about the situation with rising inequality because it has the potential to undermine progress with national growth and poverty reduction, and it also could weaken social cohesion and worsen social ties within the country. Now, according to FOFAC and ZEOFAC, one potential explanation for the non-trickle-down of income could be related to the nature and causes of economic inequality, and therefore it becomes important to analyze and understand the economic determinants of inequality at a more disaggregated level. The empirical exercise is therefore justified for Ghana, given that income levels are relatively low and poverty implications, therefore, of a more equal income distribution could be significant. So these are the research questions that we explore in this paper. We ask, what are the micro-level determinants of economic inequality in Ghana? We also explore whether the effects of household attributes on household inequality differ across rural and urban households. A secondary objective is to find out what the common correlates of poverty and inequality are at the household level in Ghana. Now, a lot of the studies on inequality have tended to be conducted at the macro level using time series data. Fewer micro-level studies have been carried out to examine variations in inequality at disaggregated levels. So examples of the ones that exist are the subgroup decomposition exercises and also the decomposition of total income by the various factor components. Regression-based inequality techniques are fairly new, but they are still a very important contribution to the existing literature because they address weaknesses that are inherent in subgroup decomposition analyses. Now, some studies have been conducted using these regression-based techniques in the analysis of inequality. So, for example, Rahman, on his study on Bangladesh, found out that variables like land ownership, farm assets, education, household dependency ratio, and location are important correlates of inequality. In Europe, Asbland and Bath found that education and occupation are important things to consider in examining the correlates of inequality. And in Portugal, Budria found that age and marital status are also important. The study by Cowell and Fioro in 2009 looked at these correlates for US and Finland. And in US, they found that having a master's degree or qualification or PhD and also the age of heads are important in explaining inequality. Whereas in Finland, an undergraduate degree and the number of income earners in a household are important correlates. Fewer studies have been carried out in sub-Saharan Africa. In Botswana, Okach finds that primary education and age are negatively correlated with income inequality, while secondary school education, number of children, and working adults within a household are positively related with income inequality. In Cameroon, EPO and Bay also found out that a number of different variables, including health, urban residency, access to farmland, among others, are important determinants of household income inequality. And in Ghana, the 2017 paper by Dankwa and Ohiming showed that urban residents, education, formal economic activities, and a lack of coverage by the country's national health insurance scheme are important correlates of inequality within the country. Now, what is the contribution of the present research? First, a lot of the papers that I've already talked about tended to use cross-sectional data in the analysis of variations in inequality at the household level. In this paper, the panel nature of our data set allows us to have a more dynamic exploration of inequality, and this would be the first study of its kind for Ghana. Second, the regression-based approach is fairly new, but it's very attractive because it overcomes a number of limitations that are contained in the regular subgroup decomposition of inequality exercise. Finally, existing research at the micro level have proxied inequalities by either welfare ratios or also using per capita expenditures. However, in this paper, we propose the use of another proxy for inequality. Here, we're going to be using household expenditure deviations from the population mean as a proxy for inequality, and we propose that this will be useful as a supplement to the more common measures that are used in the existing literature. Now, for this analysis, we use data from the Ghana Socioeconomic Panel Survey. It's a nationally representative data set that covers about 5,000 households in Ghana. Currently, there are two waves of the data set available for 2009 and 2014. A third wave should be available relatively soon. We believe that this data set is ideal for the examination of our research questions because there's information on household, socioeconomic, and locational characteristics. Perhaps also very importantly, there's data on consumption aggregates at the household level. Now, when we think about inequality, it can be conceptualized as a situation where different individuals or households have different levels of income or expenditure. Now, economic inequality mainly focuses on the relative position of these individuals or households along an income or consumption distribution. And it is along these lines that we create our dependent variable, our proxy for household inequality in this study. Now, the dependent variable for this study, or our proxy for micro-level inequality, is each household's deviation of its expenditure from the population mean. So we calculate it, as you can see on the slide, using that formula. So each household deviation score is calculated as the log of the ratio of the population mean expenditure to the household expenditure, and this is weighted by the population share. So the distribution that you can see at the bottom of the slide is the distribution of each household's deviation score for 2009 and then for 2014, so for both waves of the data set. Now, households that are further away from zero, which is constructed as the population mean, are associated with greater measures of inequality, while households that are closer to zero, the population mean, are associated with smaller measures of inequality. So therefore, there's greater inequality with distance from the origin, or with distance from the population mean. Now, to facilitate the interpretation of our regression results, what we do is to take the absolute values of these household deviation scores. So we do that by transforming the data set from what you can see, or transforming the distribution from what you can see on the left to what you can see on the right. So essentially, we are treating deviations from zero, or the population mean, on either side of zero symmetrically. So with the distributions on the right, again, increasing distance from zero is indicative of increasing inequality. Now on this slide, I'm showing the summary statistics. So here I'm showing the study variables. You can see the dependent variable, which is a household deviation scores, the construction of which we have just discussed. And then I'm also showing the explanatory variables that are included in the analysis. So for example, we included information on the gender of the household head. So you can see that in 2014, about 61% of all households report that they were headed by males. On average, a household head in 2014 was about 50 years of age. There's also information on the marital status of household heads, and in 2014, about 58% of household heads reported that they were married. We also include information on the highest education level attained by the household head. In 2014, about 2% of heads reported that they had no education. About 20%, 19.4% of households reported that they had a primary education. And the highest proportion, about 68% of household heads, reported that they had secondary education, while about 10% of heads reported having completed a post-secondary education. But there's also information on the dependency ratio for each household. Now, the dependency ratio is calculated as the ratio of dependents to the total household size. Here, dependents are children who are below 15 years of age, and then adults above 65 years of age. So looking at 2014, for example, we can see that on average, each household is made up of about 37% of dependents. There's information on household heads who report being employed. So in 2009, about 61% of household heads were employed, compared to about 88% of heads by 2014. We also include information on whether or not households have access to agricultural land, whether they are registered under the country's national health insurance scheme. There's information on ethnic and religious affiliation, in addition to regions of residence for each of these households. Now, before I talk about the empirical specification for the regressions, I want to show you some of the subgroup decompositions that we do in this paper. So on this slide, I'm showing the subgroup decompositions by gender. So if you look at the figure at the bottom of the slide, we notice that consumption inequality appears to be higher among male-headed households compared to female-headed households. Now, between 2009 and 2014, the measure of inequality among male-headed households appears to have fallen, although it rose slightly in female-headed households. It's important to point out, however, that within group differences are accounting for more of this observed inequality than between group differences. And between 2009 and 2014, the contribution of these within group differences has decreased over the period. In this slide, I'm showing the subgroup decompositions by locality. Again, if you look at the figure at the bottom of the screen, you notice that inequality appears to be higher in rural households compared to urban households. over time, inequality has risen in both of these locations, but it's risen, there's a greater increase in rural areas. Again, within locality differences are contributing more to the observed inequality than between locality differences. And here, the contribution of within locality differences has increased between 2009 and 2014. In this slide, I'm showing the subgroup decompositions by education. And if you look at the figure at the bottom of the screen again, we can see that consumption inequality appears to be highest for 2014 among household heads that report having primary and secondary education. Now, some individuals could argue that having access to more education should reduce inequality. Because then you have more individuals being educated and then earning incomes. However, some others have argued that having access to education could further increase income gaps if those who are educated find it difficult to find jobs after they've completed their education. So this might explain the pattern that we're seeing in the figure at the bottom of the screen. Again, I want to, and we might see that over time, however, inequality is falling more among household heads with lower education. Again, within education group differences appear to be contributing more to consumption inequality than between education group differences. However, between 2009 and 2014, the contribution of the latter appears to have decreased. On this slide, I'm showing finally subgroup decompositions by the 10 regions, the then 10 regions of Ghana. As you can see, the Upper East region has the highest inequality for 2014, while the Greater Accra region has the lowest inequality measure. And there are differences in inequality trends among the different regions. So you have regions like the Greater Accra region, Volta, Eastern, Western regions that show a decrease in inequality between 2009 and 2014. You have other regions, however, that show an increase in inequality, such as the Upper West region, Central region, and the Upper East region. Here also, within region differences are contributing more to the observed inequality than between region differences, although the contribution of within region differences has declined between 2009 and 2014. So to summarize, as you can see, the standard subgroup decomposition exercise is useful to see how inequality varies between different groups or categories of people. And with the benefit of our panel data, we can see how these changes are occurring over time. In Ghana, it's important to emphasize that a lot of the inequality that we see is as a result of within group inequality rather than between group inequality. And this is a point that has been supported by Enim, where he says that the observed rising inequality in Ghana is driven largely by within group inequalities. Now, despite the usefulness of this subgroup decomposition exercise, as I hinted at before, it doesn't control for certain characteristics that could be correlated with certain variables. And to this end, for the purposes of this paper, we adopt a regression-based analysis technique. Now, given the panel nature of our data set, we use a Houseman test to determine what is more suitable to run, a fixed effects model or a random effects model. And results of the Houseman test suggest that the random effects model would be more suited for the purposes of the analysis and given our data set. However, in the full paper, we do present results from both fixed and random effects, but for the purposes of this presentation, I'm just going to show results from the random effects model. So the model is given on the slide, and the dependent variable is the absolute value of each household's expenditure deviation from the population mean. And this is what we discussed earlier on the construction of this. So we regressed this dependent variable on a host of explanatory variables, and we discussed what these were also in the summary statistics table. Here, T is a term that contains the year and region indicator variables and their interactions to control for region-specific time trends. And then we also have the tau representing the household random effect, and then E for the error term. Because we suspect that the returns to household characteristics may vary, we run separate regressions for rural and then urban households in Ghana. So here, the dependent variables then are the absolute values of household expenditure deviations from the rural and urban population means, respectively. This is a table that's showing the results from the random effects specification. So we'll look at what's going on with the male household head variable. So even when we control for all of these other explanatory variables, we find that it's still the case that the inequality in male-headed households is higher compared to that for female-headed households. And this is true particularly for urban households. We find that older household heads are associated with decreasing inequality, and this could be because as individuals grow older, perhaps they accumulate more labor market experience and are able to see increases in their incomes. And this relationship is true for both urban and rural Ghana, although the relationship is non-linear. We also see that household heads that are married are associated with smaller levels of inequality. And then we also control for the education level of household heads. And we find that for household heads, compared to those who have no education, household heads that have primary or post-secondary education in rural parts of Ghana are associated with increased levels of inequality. And this can be explained because in rural parts of Ghana, not everybody may be able to afford to get an education. And therefore, those who are educated are able to engage in non-farm enterprises, which come with higher returns. And therefore, this will lead to a widening of the income gap between those who are educated and engage in these non-farm enterprises compared to those who are not educated and engaged in agricultural activities, which come with relatively lower returns. The variable for dependency ratio, we see that this is positively correlated with increased inequality, particularly for urban households. We also see that in the full sample, household heads that report being employed are associated with lower levels of inequality. And then in urban households, access to farmlands is associated with increased inequality. And then we also see that households that report being registered under the country's national health insurance scheme are associated with lower levels of inequality in both urban and then rural Ghana. Now, as a secondary objective, we also wanted to examine, see whether there are common correlates of poverty and inequality at the household level. To this end, we run another set of regressions, this time with a dependent variable being poverty, and we proxy this as the log of expenditure per adult equivalence. So we run a regression effects model, although for this presentation, I'm going to talk about the results from the random effects model, although in the paper we do show results for both fixed effects and then random effects model as well. So the model for the poverty regression is given as what you can see on the slide, and the explanatory variables are as previously defined. Now, the full set of regression results are contained in the paper. But what we wanted to do for the purposes of this presentation is to highlight 4 different cases of correlates of poverty and inequality at the household level in Ghana. So in the first case, we see some variables that are correlated both with increasing poverty and then increasing inequality. So for example, households in urban Ghana that have access to agricultural lands, urban households with high dependency ratios, rural household heads that belong to a traditional religion, and also households that reside in rural areas in some regions of Ghana, like the central region. Now, in the second case, we do see some variables that are correlated both with increasing poverty, but also decreasing inequality. Here, so older household heads in urban areas fall under this category, and also being married. So being married is associated with increasing poverty, but decreasing inequality in both rural and then urban Ghana. We do have in case 3 a variable that is associated with decreasing poverty and increasing inequality. And as we discussed before, this refers to households in rural areas who have access to some education. And the final case is where we see variables that are related or associated with decreasing poverty and decreasing inequality. So here we see that the provision of social safety nets being covered by the country's national health insurance scheme is protected because it's associated with decreasing poverty and decreasing inequality. And this is true for both rural and then urban Ghana. Urbanization is also associated with decreasing poverty and decreasing inequality. And then finally, providing employment or access to employment opportunities for rural households is associated with decreasing poverty and decreasing inequality. So to conclude, some important policy applications can be derived from these findings. So yes, it's important to remove certain constraints to education, but the manner in which it is done is going to be critical for reducing poverty and inequality. So for example, it's important to make sure that there's uniform access to education in rural areas. So currently in Ghana, we have the universal secondary school education for all. So this would be a step in the right direction in terms of reducing poverty and also reducing inequality in the rural parts of the country. We also see that higher dependency ratios are associated with worsening poverty and inequality, and therefore it would be important as a country to limit fertility through, for example, the reduction in unwanted and or mistimed births, because we know that this will have positive implications for household poverty and then inequality as well. It's also important to provide to ensure that we are providing infrastructure and employment opportunities for households that reside in rural areas and also in the northern parts of the country. It's going to be important to target subgroups that are particularly vulnerable. So as we saw, people who belong to the traditional religion, particularly in rural areas, in order to ensure more inclusive growth. And I apologize that the final point has been cut off, but that was simply speaking to the importance of social safety nets, like the country's national health insurance scheme, because we saw that for both rural and urban households, the provision of these social safety nets would lead to a decrease not just in poverty, but also in inequality. Thank you very much for your attention. And if you have any comments, I'm happy to take them at this time. Thank you.
Thank you so much, Nkechi, for this wonderful presentation. I see that for now we don't have any questions, so I do have some, and maybe while we start chatting, other questions might arise. I think that, well, maybe my first question would be more on the construction of the variable per se. And if I understood things correctly, you're building it on the population average. And I was wondering what would happen if you were to segment the population and not report the deviation to the average of the entire population, but maybe try to build subgroups such as urban, rural, but also maybe unemployed, unemployed, etc. So, and then I also had a question more on the lower contribution of between education levels compared to within. Would this be a proxy for a lower skill premium in Ghana? Would this mean that, given that the between education levels inequality contribution is lower to the average inequality levels, would that translate that finally education is not such a big driver, but then it kind of contradicts the results from using the panel? And I will stop here for now.
Okay, thank you very much for the questions. So that is the very first point is really important, because you're saying, well, given as we are constructing the deviations from the population means, well, then if you're looking at what's happening, as I did in the regression, looking at rural and an urban household separately, it would be very important then to segment the population by rural and urban, and therefore generate population means for rural and urban areas. And this is what we do in the data, in the analysis. So if that was not clear, we do that. But you had another suggestion. So perhaps, do we want to segment by perhaps being employed versus not being employed? Okay, yes, that's something to think about as well. So we had not segmented it by employment status, just by locality. And these are the results, but it's certainly possible to segment it and run regressions as well.
It can also, I guess, be on education levels or other types of segmentations.
Exactly. Education levels as well. Yes, it should be possible to do that as well. Yes. And then so I apologize. I didn't get the full question for the second point, but I think you talked about we found that for education, we are seeing that the within differences are more important for explaining inequality compared to the between differences. And then you asked something about income.
I'm just wondering about how does this translate into an education or skill premium? Because I would have expected, for instance, that inequality be driven more maybe by between levels
Yes.
inequality than within.
Right.
So, but maybe I'm just misinterpreting the results.
Right. No, that is, I mean, some of it is explained by between, but a larger fraction is explained by within. And I think that's because if you look at what's going on, so we have a lot of individuals who have these types of educational qualifications. The problem then becomes access to jobs. So if you have a secondary education, for example, that's a good thing. But if only a few of you are able to find jobs, then that's likely to widen, the gap between even within that, for those who have secondary school education, those who have jobs will have higher incomes, presumably, compared to those who do not. So this is one thing I think explains why the between education group inequality is so prominent.
Yeah, thank you so much. And I think Monica also had a question
Okay.
on whether you find anything interesting with regard to inequality in various regions. So having more of a local view on inequality and what does the paper tell us on that?
For various regions. Okay, well, we do find differences in inequality for different regions in Ghana. So they're not overly significant, but for example, we find that in central region, individuals who live in central region, particularly in rural parts of central region, are associated with greater levels of inequality. This is also the case in the upper east region of the country. Unfortunately, other regions, although we include them in the regression, don't show significant results. But then the full set of results are included in the paper.
And for the participants, maybe you could give us a few hints on why you think that, for instance, the central region has a higher inequality.
Well, so I think it would be easier to talk about perhaps what's happening in the Upper East region. So in the Upper
Mm,
East region, we see that for some reason we do see quite a number of different interventions
okay.
happening in the Upper East region, be it related to non-farm enterprise and also even with respect to agricultural interventions. And so, well, if you have certain people receiving some of these interventions compared to others, so in the central region, we see that over time, the inequality has been increasing, and it could be as a result of these. It could also be that so individuals who are particularly inclined are very motivated to take advantage of these, government interventions and even private sector interventions as well. And this could be what is driving the inequality in this region. In the central region, I want to say that it could be following a similar pattern. But at this point, I don't have as much information to make that claim. But for the eastern region, it's a lot as a result of some of these interventions that are coming in. So people are taking advantage, others are not, and it's leading to some degree of reduction in poverty, but definitely an increase in inequality.
Yeah, I think it's quite interesting this these results on finally with the levers to act on poverty and inequality, and as you say, these types of interventions could have contradictory impacts on poverty and inequality. And the presentation that you made of the tables also gives us an idea on that. And this is something that maybe would be nice to chat a bit more on, because on that table with the four cases, it might be interesting to actually point out which are those on which we could act upon. Like, for instance, I would guess that, well, of course, it's also social safety nets are maybe the most obvious one, but then there's also the issue of rural employment.
Yes.
And I don't know if you had already some ideas on which are the levers. Has action for each quadrant.
Yes. Do you want to pull up that?
Yes, I will do that right away.
So the others can see.
Up.
It's at the close to the end.
Almost there. Up. Sorry.
Yes, please. Yes. So, well, for example, we can look at, so as you talked about the case 4, where we see something like social safety nets. So right now we have the National Health Insurance Scheme, and this is, I included a control for this in our data set, and we see that the provision of this is associated with reduced poverty and inequality. But then we also have other interventions like the country's livelihood empowerment against poverty program. So even though the data wasn't available to include in this analysis, it's we can presume or assume that it is likely that this is also having positive effects on poverty and also reducing inequality. Here also we see that urbanization is also another factor that's important for reducing poverty and inequality. And then, as you talked about, rural employment. So in rural areas, we see that usually the levels of poverty will tend to be low. In some cases, some individuals who reside in these areas are engaged in, if they are working at all, they are engaged in perhaps low return activities. And so providing gainful employment is likely to increase income levels, which would have the effect of reducing poverty. But also, if this is done uniformly, it can also have an effect on reducing inequality. At least this is what our results are showing. And to the point of having, making sure that people have equitable access to some of these interventions or infrastructure. I mean, if you look at what we are what we see in case 3, providing education to household heads in rural areas is associated with a widening of the income gap. And I explained before, this is because very few individuals in rural areas can afford to be educated. So what happens is that if you are educated, you are likely to be engaged in a non-farm enterprise, which comes more often than not with higher returns. On the other hand, if you are not educated, you are engaged in farming activities, which more often than not come with lower income or lower returns. And so if there's only differential access to education, well, then we're going to see a widening of the gap between those high income earners and then those who are earning low levels of income because they are engaged in agriculture. And this will lead to a widening of inequality within this area. So yes, higher education reduces poverty as expected, but if it isn't done uniformly, as is the case in rural areas, that can lead to a widening of inequality. But having said this, recently we did have the introduction of a free SHS a program by the government. So what this means is that everybody has access to free secondary education in the country. So even in rural areas where people may not be able to afford this level of education, this government provision makes it possible to do so. So over time, perhaps when with more recent data sets, we'll be able to check to see whether in rural areas we're seeing any impact of this more uniform access to education in terms on inequality within the country. We also have other things like the dependency ratio, for example, if you look at case 1. So what we find is that in urban households where you have a high dependency ratio, where you have the ratio of dependence to the total household size being relatively high, that's going to have negative implications for poverty and inequality. So what it means then is that as a country, we want to think about, as much as possible, keeping the number of dependents low. One way we can do that is to limit our fertility. Now, this isn't, I'm not talking about limiting wanted births. So we have cases where some births are unwanted or some births are mistimed. So it could be possible, perhaps, to try to limit fertility from these sources and try to curb the number of dependents that we have, because we are finding that it would have a positive implication for poverty and also for inequality in the country. These are the main ones I think are actionable. With the other ones being married and things,
yeah, it was. I would have thought. Then I also had a question on the farmlands and how you link this to the opposite case where you have urbanization, which can decrease poverty and decrease inequality. But then once you have urbanization, you might have an increase in the demand, for instance, for food items and so on. So very often the reaction would be farmland. And I was wondering how you fit these two.
Thank you for this question. So the thing I want to say that this point about farmlands, so it's one of the variables that I'm concerned could have the potential for reverse causality, because it's difficult to say whether households are going into farming because they are poor and needing an alternative source of resources, or whether having access to these farmlands is leading to poverty and therefore increasing inequality. But I mean, we do have, I would say on that point that given as we know that over time we're becoming more and more urbanized as a country, this is going to have implications. And we have a lot of rural urban migration as well. So therefore, there's fewer people in rural areas to generate our food resources. There's going to be some implications for the food security of the country. And therefore, urban farms are something that could be encouraged. Yes, we're dealing with smaller land sizes, but perhaps this means that more intensive ways of cultivation could be encouraged. You see, so for now, I don't want to imply any causal relationship between farmlands and then the implications for poverty. But I will say that it's something to consider. Thinking about these types of urban farming areas and making sure that they are intensive so that they can supplement the food that our growing cities and urban areas need. So that's what I'd say.
Thank you so much. And I see that in the meantime, one of the participants asked a question which is very related to one of my questions, the one on my list, and it's actually linked to the migration and the interdependency between rural and urban areas, and how migration can actually help you relate the contrast in terms of education and its impact on inequality in urban and rural areas.
And so you're asking how the effect of migration
How do you
on
take into consideration exactly this interdependency between rural and urban areas that's created through migration?
For now, I don't know that we do.
With the panel, I guess that you could also see who moved between waves and
Yes,
the reason for that.
well, yes, it's possible to do that, but for this presentation, we did not do that at all. But that is a very, very reasonable question and a reasonable request, and it's something that I have made a note of. It's something that we can do in future versions of the paper, but unfortunately, we don't look into that for this paper.
No, so
Yes.
thank you for the very question for the very interesting question to the participant who asked it, because I think it would be interesting at least to have an idea of maybe how this can shape the results that you find.
I would agree. I would agree.
Um,
Yes.
and then I also have a question on the social safety net, because if I understood correctly, you only look at the national health system and whether people have access to the health system, right? And I was wondering if there were any other variables that could be linked to safety net or to social security as a whole that you have in the survey that you could use as to see which kind of different safety nets have an impact on inequality and poverty in this, well, on inequality in this case?
Okay. Yes, that's a very good question. Well, we do have there's data on access to social security benefits.
Okay.
I believe there's data on that. We did not look at that for this, but it is something that it is possible to look at. I can go back into the data set and be sure about the number of observations, the number of people who provide responses to this. But I do remember seeing a variable on this, and I can look in the data closer in the data to see what other safety nets
Okay.
we can use. So for now, we're only using the NHIS, but I will look through. I'm sure there could be one or two others that we can use to complement the research. I've made a note of that. Thank you very much.
And I see that actually Marlene also had a question linked to this migration topic, and whether you could look just at migrant households that live in urban areas in order to take into account this interdependence between urban and rural areas. I think that's a very interesting suggestion.
Yeah, it would be possible. It would be possible to do this. Yes. So, I will make a note of this as well. If there are any limitations, it could be with the sample size, but I'm going to look into it to see. I think this would be certainly interesting to look into. So, thank you very much, Marlene. So I will look into this as well.
Great. So I don't know if there are any other questions. Oh, yes. Yes, it's perfectly okay to ask other questions. Thank you so for these. Yes, and to guess on whether you could clarify the part where you refer to the fertility decline.
Okay. So I was saying that what we find in the presentation is that households that have higher dependency ratios have increased poverty levels and are likely to also to experience increasing inequality. So we calculated the dependency ratio as the number of dependents, so that's children below 15 and adults above 65, the ratio of these dependents to the total household size. So what we're seeing is that if the number of dependents are higher, this is leading to increased poverty and inequality in households in Ghana. So one policy implication of this could be, well, then how do we keep the number of dependents lower? One way to deal with this could be to try to keep fertility levels lower. And this is not to say that we should reduce, we're asking women to reduce their wanted children, no. But we do have some births that are unwanted or that are mistimed. And having adequate access to contraceptives, to family planning programs could help to limit fertility through these avenues, through limiting unwanted births and or mistimed births. And if we do this, we should see a decrease in the number of dependents in different households, and therefore see a decrease in the incidence of poverty and then inequality in these households. So this is my interpretation of the result and the policy application that could be derived from this.
And maybe a little bit linked to that, but I don't know if you'll have the answer right now, because what you see is, especially in urban areas, and I'm linking this to the previous discussion on migration. And do you think this is more due to migration? And in this case, is it migration for education reasons? Or is it just because people in urban areas tend maybe to have more children as they have more economic opportunities?
Well, it could be both, because in urban areas, we shouldn't just assume that fertility in urban areas are universally low compared to rural areas, because in urban areas, we do have the urban poor, okay, which tend to show relatively high fertility levels. So it could be that this is coming from this group of people. But of course, I agree that it could also be as a result of increased child fostering, so migration from rural areas to urban areas. I believe that this could actually be. And in terms of the policy application, I cannot say that, well, then don't let them come, especially. But then, yes, it's another aspect that I think should be discussed in the paper, because it's also a source of these higher dependency ratios, particularly in urban areas. So I'm going to make a note of that so that I can include in the paper.
Now, and one point where we could also link it to safety nets is, for instance, providing safety nets which are linked to the children per se, like children allocations or something around this type of intervention might decrease, might actually take out this factor from the increasing poverty, increasing inequality quadrant.
That's true. Okay, so I'm going to look to see if there's any such interventions in the data. But yes, that presumably could even remove the significance on this variable. Yes, I would agree.
And I see that Maria also has a question. on comparing the poverty impacts and inequality impacts. And his question is actually, how much policy concern is there for inequality in Ghana? So do you think that through this paper you could advocate for a higher focus on inequality as well as poverty, and not just poverty?
Yes, so that's a really great question, and this is why we wanted to show, give an idea of this impression, because well, in Ghana we tend to focus quite a bit on poverty reduction, but more recently we are paying more attention to inequality, particularly since we discovered oil and our economic growth rates have been impressive. There have been calls for governments or for certain interventions to make sure that this growth is more equitable, so everybody is benefiting from this growth. So yes, the conversations have started, and there's a lot of government interest, not just in poverty anymore, but also in inequality. And that's why we included this particular component, this table, because we show that just because you're focusing on poverty doesn't mean that the other section, inequality, is being catered for. So there needs to be a more nuanced approach to making sure that we are reducing poverty, but also making sure that we are not widening the income gaps between individuals. So yes, I think that there's going to be there's already interest, and hopefully we should be presenting some of these results to the government in the next few months, and it just makes the argument stronger as to why we should continue having these discussions, and government should remain concerned issues of inequality in Ghana. So yes, thank you for the question.
Yeah, I think we have other questions on the issue of higher education and its positive impact on inequality with negative impact on poverty, and whether you could tell us which is the reason. But I think you already mentioned some of that, so I don't know if you'd like to add any more info on that part, but also whether the policy of the free secondary education might have a similar impact. Again, it's something you've also briefly touched upon, so I don't know if you'd like to add anything else.
Well, the point about why we see that, increased education we find is reducing poverty as expected in rural areas as well. Well, because if you're educated, the expectation is you're able to find, you're likely to be engaged in non-farm enterprises, which comes with higher incomes. So we're not surprised to see that is associated with lowered poverty. But on the other hand, particularly for rural areas, access to education, we are finding, given that it is so unequal, particularly at the time that the data set was collected, is associated with increasing inequality. And I explained that as well, those few who are educated will have access to higher incomes from non-farm enterprises. Those who cannot afford to be educated then will be engaged in agricultural activities with the presumably lower returns. And this will lead to a widening of the income gaps between those who are educated and those who are not. But I did mention that the situation may change in the coming years, because we do have the government, it has implemented a policy of free senior high school education across board for all households in Ghana. So in rural areas where before you may not be able to attend school because you cannot afford to do so, now secondary education is free. So that should that's expected to not only reduce poverty, but hopefully narrow that gap between those who are formerly uneducated and those that will be able to be educated now, given the policy. I'm sorry, I missed the second question.
It was on this free secondary education.
Okay. Okay.
I think it was already responded to that. And I think this would be probably the last question. Are the social safety net programs universal and uniform over rural and urban areas, or whether they're different?
This is a really good question. Because I want to say that with the National Health Insurance Scheme, in theory, it is supposed to be uniform, in theory. But in practice, what we find is that it's sometimes difficult for health facilities in rural areas to receive accreditation in order to accept these registered NHIS patients. So although, but we do have some hospitals that can accommodate this. They are accredited and then they are registered under the NHIS scheme. But although we have more accredited hospitals in urban areas than in rural areas, what we are picking up with this research is it is still protected even for the relatively fewer households that receive this safety net in Ghana. So as a policy application, we need to sort of make sure that we can accredit more of these health facilities, particularly in rural areas, receive the equipment that they need, the personnel that they need in order to be properly accredited. Because we see that even at this current unequal distribution, we see that the rural households are benefiting from this in terms of their poverty and then their inequality status. So I'm talking about the National Health Insurance Scheme because this is the one that I used in the paper. We do have other social safety nets like the Livelihood Empowerment Against Poverty program. This is not necessarily uniform. It's only targeted to those who are extremely poor within our society. So I haven't controlled for this in this data set because of the data limitations. But so some of our social safety nets are uniform, but not others.
Perfect. Thank you so much. A huge thank you to you for the great presentation, very interesting discussion, and thank you to all of our participants for such great questions. So we will stop here. Thank you again. And next week's webinar, it will actually change a little bit because it will have to be scheduled at 11 a.m. So not at 5 p.m. as the rest of them have been, because we will accommodate the team which is based in Vietnam, and they will present their work on environmental changes and inequality. Thank you again, and we welcome to see you maybe next week. Thank you again, Katie, and goodbye to everyone.